Hello, everyone. So awesome to be back with you again today. Dr. Isaiah Cochran here, your AMSA National President, and we have such a wonderful session for you today. So this is National Osteopathic Medicine Week. So glad to be able to bring you so much information. I know that we just had a session yesterday where we were speaking about Earth Day, and now we have the opportunity to hear from some very young osteopathic physicians, and they're going to be sharing some great information with us. So with that being said, I'm going to pass it over to Jared Mullen, who is on our DO advisory board, and let him take it over. Thank you all for joining us today, and I look forward to hearing from you all and learning so much.
Thank you. Hello, everyone. Thank you for joining us today. I'm Jared Mullen, Vice Chair of the DO Advisory Board of American Medical Student Association, AMSA for short, and we're here to recognize NOM Week. This is the first year of the AC-GME merger. As AMSA, we want to provide some information for students interested in becoming a physician. We put together a set of talks to give you guys an idea of some insight into the training and practice experience for DO students. So many students and schools were worried about the merger, how it would go this year, and the effect on the application process and the match. For viewers who aren't aware, the match is what medical students participate in order to be placed at residency. With the merger, there's now a unified AC-GME match for both DO and MD students. As expected with the switch to a single accreditation system, the number of DO applicants participating in the NRMP match significantly increased. But the data from the NRMP shows overall that the number of DOs that matched also significantly increased to accommodate. Overall, DO students were still able to successfully apply and match into PGY1 positions at approximately the same overall percentage to 2019. We have some of those students here today who have volunteered their time to tell us more about their experience. Audience, please feel free to ask questions in the chat. If we have time permitting, we will try to answer them at the end of the session. So class of 2020, thank you for being here. I know you have a lot to adapt to with everything going on the past few months. We appreciate you taking time out of your day to come talk to us all. I would like to start off by allowing you all to introduce yourselves, where you went to undergrad, med school, and which specialty you chose and where you're headed.
Hey guys, my name's Anna Swisher. I did my undergraduate degree at Texas A&M University, and it was in engineering. I moved to Alabama to go to VCOM Auburn for medical school, and I matched into family medicine, and I couples matched, so I'll be answering questions on that today also.
Hey, how are you doing? My name is Michael Ulmer. From Fairhope, Alabama originally, but I went to UAB for undergrad. Majored in chemistry and went to Edward Via College of Osteopathic Medicine, Auburn, Alabama with her, and ended up matching orthopedic surgery at Jack Houston Memorial Hospital. And
hi, my name is Madison Beckman. I'm also one of the graduating fourth years from ACOM, which is the Alabama College of Osteopathic Medicine in Dothan, Alabama. I'm originally from Atlanta, Georgia, and I went to Florida State University for undergrad, where I majored in exercise physiology. I also have a minor in chemistry, biology, and psychology. And I recently matched into OBGYN, which is obstetrics and gynecology, at the University of Connecticut.
Hi, everyone. I'm Kirk Neuer. I am also from the Alabama College of Osteopathic Medicine in Dothan, Alabama. My undergraduate major was nursing, and after that, I spent 2 years working in the intensive care units and in the emergency departments in Birmingham. I then went to medical school at ACOM, and then just recently matched at St. Louis University for anesthesia.
Hey guys, my name is Sam Hagman, and I'm also a fourth year graduating from ACOM. So I finished trifecta to make 3 ACOM students here. I matched into general surgery at the University of South Dakota, and I did my undergrad at the University of Florida. Go Gators.
Thank you all for introducing yourself. We'll go ahead and step into the first question then. So for our first question, how did you choose your specialty? Did your desired specialty ever change? And if so, what or who inspired the change?
So I started medical school not knowing what I wanted to do. If anything, I wanted to do emergency medicine, but really I liked everything the first 2 years. I started my rotations and really enjoyed OBGYN, so I thought that that was what I would choose. At that point, I had not done a rotation in family medicine. And then when I did do a rotation, I ended up really liking it. And so I did another rotation, and I worked with a doctor who was not one of my favorite doctors that I worked with, but I still loved going to work every day. So that really told me that I loved family medicine. I didn't just like specific physicians I was working with.
Thank you. That does sound like an interesting journey that brought you back here, and it's good to know that information because I know we constantly are trying to decide what we want to do. So hearing experience where you didn't start out knowing what you wanted to do, I'm sure is helpful for other students in the same position.
Can I also say something, Jared?
Oh, sure. Go ahead.
So when I first started in, I thought I wanted to do emergency medicine as well. I worked in the emergency department as a nurse and really liked the critical care aspect of medicine and what might be provided in my future. So going in, that was definitely my game plan, and I was even president of the emergency medicine club. However, on rotations, that's the great thing about rotations is being able to see what you might like and what parts of each specialty that you might find that you might actually want to do that for a career. And that's where I landed on anesthesiology, which has quite a bit of an aspect of critical care. Most anesthesia departments are anesthesia and critical care. So just because you may have an interest in one area, you do definitely need to reach out and look at different specialties and see if there's parts of specialties that you might actually like another field to be your actual career.
I agree with that. I think just doing rotations and being able to experience it is completely different from what you may know about the profession. And so actually going and doing it really helps. And I agree with you. I encourage people to try things that maybe you weren't necessarily interested in, and you may try and find out you enjoy it. Okay. So moving on to the next question. As a pre-med student, it can be challenging to find physicians that allow you to shadow them for observation hours, and sometimes even more challenging to find DOs. What advice do you have on that?
Hi, so this is a really good question, and I'm glad that someone asked this. I wasn't actually sure that this was going to pre-med students, but when I was a sophomore in college, a friend of mine at FSU, who is now a medical student at ACOM as well, told me about osteopathic medicine. Her doctor was, or her mom was a DO. And so she kind of told me what it was, and I thought it was interesting. So I'm from Atlanta, and when I was going home for the summer, I decided I wanted to shadow some physicians, and it might be a good idea to at least see a DO and talk to them and maybe get their take on it. So what I did to find them was I literally just Googled for days different DOs in Atlanta, and so you can actually go on different websites for the hospital and look in different physician groups and find out which doctors work there and who's a DO. And I just found all of their emails and I emailed everybody I could. So I probably emailed 100 different people, and I think one person replied to me. And that one person has still been in my life to today, and he was a great mentor. And so I shadowed him for many years, and he kind of helped me even through the match this year. And it was really awesome. So I encourage you to reach out. Google is always a good resource, and just email anybody you know. Ask around, see if your friends have parents who work in the medical field who might know a DO. I think having that letter of recommendation from a DO says a lot when you're applying to an osteopathic school, because it shows that you truly do know what it is and you know the difference. And it's nice to have a mentor as well.
I'll also second everything Maddie said. Definitely Google is your best friend. Utilize it. The AOA, they'll even have a web part on their website where you can search for DOs that are in your area. On top of that, my key to finding not only a DO to shadow, but also to get that letter of recommendation that she was referencing, which is, I think, supremely important if you're applying to an osteopathic school or institution, was the State Board of Osteopathic Medicine, and they have a couple meetings for undergraduate students. So I would definitely reach out to your local state boards of osteopathic medicine, seeing if they're having any upcoming events. And that's a great place to always come in contact with osteopathic physicians that are not only interested in the field of osteopathic medicine and are big proponents of it, but also people that are willing to take on students to have those opportunities to kind of have a contrast between the different types of medicine and also to be able to shadow them and get letters of recommendation.
I agree. That's those are some of the best ways. I think most of us found doctors to shadow that way. I mean, you'll find when you start asking around, a lot of doctors really love if you show interest in the field, and they're happy to show you their lives because they are usually passionate about the career they choose. Because medicine is a long career to start, and so when you get finished with it, finding other people interested in it is a really great thing. And so I'm sure any physician you message would be happy to have you for the most part. So I think that's the best thing to do is search around for friends, family who might be doctors, and then use those resources like they said. Um, Moving on to the next question, being the first class to apply to the merger, was there anything about the process that was different or that you didn't expect?
So couples matching actually made it easier because we were able to couples match. With him doing orthopedic surgery and me doing family medicine, I knew that there were programs that were previously MD only, part of the ACGME only, that I would be able to apply to just because family medicine is pretty DO friendly, even in the MD world. But for him, he was definitely going to be applying to a lot of DO programs because of his specialty. However, with the merger, it made it a lot easier to be able to apply those programs together and still be able to couples match. So what we did is went through and looked at every program, every orthopedic program in the United States, both DO and MD, that had previously taken a DO. And that's how we determined which programs to apply to. So I thought it worked out for us that it was combined this year.
Yeah, on the general surgery side, I agree with Anna. I think that it's hard to say if it really helped us or hurt us with the merger. I don't know if we'll ever be able to say that, but for me personally, I think the biggest thing is getting your foot in the door, because once you get a good set of interviews, more or less you're on a pretty equal playing field, is my best estimation. So if there's places that you really want to go, but you're not really sure that you can get in just based off an application, doing a way rotation or audition there is going to be your key in. I know that's tough for third years right now that are coming in because there's so much uncertainty with if you're going to be able to do away rotations. So sorry about all that confusion, but I definitely think if there's a program that you really like and you're in the competitive nature of being at least competitive for your specialty, really performing well on an away rotation is really the way to kind of get your foot in the door and get your name known there.
Oh, absolutely. I know that were some of the bigger concerns with the merger, and that's what the hope was, that some of these more competitive fields would level the playing field for everyone, so that this whole process was a little bit easier. And it sounds like it helped out with the couples matching, because I know it had to be stressful applying to do different ones because there used to be two separate matches that you participate in. But it sounds like they're about what we expected to come out of that. Which, moving on to speaking about competitive residencies, highly competitive residencies are hard to get either as an MD or DO. But would you say that it was more difficult as a DO, or has the merger helped level that playing field? I know y'all briefly addressed that previously, but if you go into a little bit more detail.
Hey, yeah. So as far as this kind of pertains to the last question as well, but I do think it helped. I think if you were planning to apply to something that was more AOA based to begin with, then it probably helped a lot, because then you don't have to choose which match you're going to enter. I don't know that we even need to bring it up, but back in the day, you had to do two separate matches and you would have to choose. So that helps for those students. It didn't quite pertain to me myself personally. I didn't apply to any AOA traditional programs. So in a way it was nice, because I felt like I was already somewhat accepted at some of these more MD programs. Although I do think that in general, for OBGYN, there's so few spots at a lot of programs that even if you're the very best applicant, if there's someone who's an equally really great applicant and they went to Hopkins for med school, then there is a chance that that could be the deciding factor. So you really do, even with the merger, still have to find a way to say, I'm just as good, if not better than this person who might have gone to this large academic institution for medical school. So it's nice because you're given more of a chance with the merger, but you still definitely, I felt, had to to prove your worth and equal at a lot of these programs.
No, I'd agree with Matt a lot. I think a lot of times, when you go to these different institutions, especially a highly academic institution, in a DO standpoint, with orthopedic surgery and applying, it was rather difficult for a lot of these allopathic places to pick up interviews. I actually did an audition rotation at an allopathic place, which is the only way I got interviewed that rotating there. But sending your application out as a DO, you kind of want to apply to a lot of places that are former DO places, DO friendly places. Like, Anna and I did the research of trying to figure out, which allopathic places took DOs and apply. I threw it up in the wind and see what would happen. But, oftentimes, it didn't shake out very well for orthopedic standpoint. For general surgery, yeah, it seems like it'd be a little more friendly. I think you kind of touched on that as well. Because I had a lot of DO general surgery buds that matched and did well. So when it comes to applications, I think if you are a DO, definitely look up all the former AOA places and apply for that for orthopedics. And if you do have a shoe in, or the president of a hospital or somebody who is an allopathic place, and all means apply, go for it, pull the strings that you can. But I think, with the merger, I think it's still kind of difficult with orthopedic from an orthopedic standpoint.
Yeah, from a general surgery standpoint, it's definitely not as competitive as ortho, so it's a little bit easier for me. I know for me applying to about 70 or 80 different places, and a decent amount of them are places I've done away rotations at, which you're not going to see in the super competitive specialties. You have to rotate there. But with that being said, there is going to be, whether it's just in my mind or not, I don't know, but I do think there is definitely a little bit of bias left as far as, like Maddie was saying, if they've got two applicants, one MD, one DO, very similar stats, they're going to take the MD, applicant 9 times out of 10 would be my guess, just based on, the name MD.
And I would say for the anesthesia world, which is a little bit less competitive than all three people that have spoken before, in terms of getting into those more competitive MD typed residencies for their ACGME accredited in the past, my best thing is to be very selective when you start trying to do away rotations. I know this year is unfortunately less likely to be able to achieve those in a timely manner and in time to get letters of recommendation. But if you are able to be very selective and try to get auditions at different places that may have only been ACG in the past, that is normally going to be your best way to get into a competitive field and in a competitive academic center.
Yeah, I'd have to agree. I think it sounds like most of those, most of what's going on is what we were thinking, and it sounds like the ones that are more familiar with DOs initially are going to be a little bit more accepting and more quick to take students on this, and they are already taken students in the past. And it sounds like that's what y'all kind of faced, and that the MD more dominated side will eventually come around, because it does sound like y'all had a little bit better chance at least getting to try and apply to those and stuff, but it may still be a little bit biased for a while. With that in mind, moving to the next question, what recommendations do you have for current OSM 1 and OMS 2s to strengthen their application to be more competitive in this now merged accreditation system?
Hey, okay, so I thought this was a really good question, and I think that we all think back to first and second year, and nobody knows exactly what it was that got them into their residency, but some things that I think are the big categories that you want to touch on. So the first thing is, obviously the first thing that happens is you want to do well in class. So your grades should be as good as they could possibly be, and your board scores as good as they can possibly be. Those are the two big things, and we all know that. So anytime people ask about the other categories, leadership, research, volunteer work, teamwork stuff, letters of rec, while those are super important, if you're not quite the student who can handle the rigor of medical school, especially first year, it's okay to take a step and say, I'm going to maybe be more involved in some of those other things second year or third year, and just focus on the schoolwork first year if you need to. And so I remember when I was stepping up to do leadership roles and research during first and second year, it was only because I had at that point felt, okay and confident with my grades enough to say, I also have the time to do this. But if I didn't, I think that that really still should be the most important thing, and that it's okay to wait. I think a lot of times students try and get too involved early on, and no matter what, those are going to be the first things they look at on your application. But with that being said, I think that the big things you want to talk about are going to be getting involved in leadership stuff, because that also covers teamwork. And at a lot of my interviews, they talked about working as a team. I mean, any specialty, you're going to work as a team. So they want to see that. And leadership can be small. It can be just being involved at your school's level, but you can also be involved regionally or nationally. And obviously, the more involved you get, the better it looks. So for leadership stuff, I would advise picking one specific maybe club or group, whether it's AMSA or SOMA, or for me, it was ACUG, and just sticking with that and being really involved in one organization instead of spreading yourself too thin and trying to be involved in 5 or 6 organizations. And then I also think you should touch on some research. Even if you just do 1 or 2 projects, do something. And that is actually a lot easier than it sounds. One of the easy ways I did research was just reaching out to our OBGYN chairman and saying, hey, do you have a patient this month who has a cool, interesting case that I can write a case study on? And a case study takes a few days to write up, and you can present it anywhere. So those are super easy ways. They don't take a lot of time. And I think all of that's important to just kind of slowly, first and second year, build that resume. I don't know if anyone else wanted to add to that.
Sorry, I think Michael was going to add, but he may have dropped. I know that they were having some issues with the internet connection. That's okay. I think you're 100% right. And just from my experience, I know I haven't gotten to 4th year yet, but I have participated in a handful of clubs, and I think you're 100% right that focusing on a handful that you know you can tackle, and even starting at one and seeing if you can handle that before you add another one, so you're not spreading yourself thin, because it is a lot of work, and sometimes things come up you just don't think about, and all of a sudden you've got 5 different things you need to do for your multiple clubs. And so, like, yes, it looks good in application for you to be participating in these things, but it looks worse, in my opinion, if you try to participate and failed at all of them because you spread yourself too thin, and you'll just hurt your grades. And so I think that's important, and that's good advice to future students to try and like experience. I promise there's plenty of opportunities. Like, I thought I missed out first year when I had signed up immediately for all this stuff, but there's a ton of things that'll come up all the time. So moving on, if they come back and want to address that question, they can, but we'll go ahead and move on. For the next question, did you participate in AMSA simulation competition? And did anyone ask you about this experience during interview season?
Yeah, so I participated in the local chapter at the Alabama College of Osteopathic Medicine. We had quite a few teams. Our school was quite active in this, and we had Dr. Giannini, which headed this up. Absolutely fantastic. And we actually won nationals 2 years ago, and then won the competition that was just completed yesterday as well. So we really heavily put a focus on simulation. In terms of on the interview trail, a lot of people saw it as a way to talk about their simulation experiences and what they offer at a residency in terms of simulation. Most major programs are getting into simulation and have full simulation suites to be able to run simulations at least once to twice a month. And so there was kind of a way for them to talk about my experiences and then also show what their program had to offer. On top of that, they use it as a way to talk sometimes about teamwork and how you worked as a team to try to overcome an issue. And so it's always good to have, like Maddie was saying, multiple things on your resume to show teamwork and dedication to the field and for continued learning in the fields of medicine, since it is an ever-evolving study of medicine.
Thank you. It seems like so Michael was able to rejoin, I believe. Did you want to go ahead and I know that we kind of passed over you for the strengthening application. Did you want to go ahead and answer that? Y'all are still muted.
Sorry.
No
Technical
worries.
difficulty here. My internet here is
I think we lost him again. Okay, so for the next question, there are some residencies that have all MDs currently appearing to be MD biased more or less, but have stated that they accept DOs. Since it can get expensive applying, is there a good way to determine if this is a front or if they're actually interested in DOs?
So this is a very good question, especially applying to something like OBGYN, which I would say is competitive, but maybe not as competitive as like ENT or ortho. So what I did is starting in December of my third year, I made this Excel spreadsheet where I listed out all the OB-GYN programs that I was interested in applying to potentially, including REACH programs and programs I thought I had a good chance at and programs that would maybe be more backup programs. And I listed all of them out on the spreadsheet. And I first off wrote, because I wasn't applying to any that were specifically AOA programs, I went through and I wrote, have they ever had a DO? So I looked at all their websites and I just wrote down, did they have one 10 years ago? Do they have a bunch? Do they have none? Just so I could know when I was applying, you know, how many am I spending money on that have never had a DO before? And what do I reasonably think is my chance of matching there or getting an interview at least? I did interview at least 10 programs that had never taken a DO ever. And at those interviews, I don't recall seeing any other DO students. And so I think some of the interviews I was surprised that I got, and it made me feel like, you know, I still would advise any student to apply to at least a chunk of REACH programs. I mean, you can't take back what you didn't apply to. So you know, maybe if you're like, I don't think I'm getting into Harvard, but I might have a good chance at a state school like Oklahoma State or something, then you want to try and have at least a good chunk of those programs so that you don't regret that you didn't apply, was my theory on it. So I interviewed a lot of places that didn't have DOs before. And at one of them, which was definitely more of an Ivy League program, they said to me at the interview, he said, you know, I'm really happy that you're here. We've never had a DO student before. And I think that's really cool. I wish we were more diverse. And that was really cool to me to hear that, you know, wow, I was so nervous that everyone was from all these crazy schools. And it felt nice to say, you know, wow, even if I don't match here, I made kind of that first step. And I hope that that will open their doors to allowing more DO students and even just for interviews in the future. So you never know, you could be that first student. As far as auditioning, I auditioned at several places that had never had DOs as well. And I felt like that was my chance to really represent DOs to their program. And a lot of them would have questions like, what is a DO? And sometimes that's surprising to hear from a doctor, from a resident. But not everyone knows. And so I think when you approach those programs, you have to take it, instead of offensive, take it as a chance to explain to them how cool it is that you're a DO and stand up for yourself. So yeah, I would say it's not necessarily a front, but you want to be reasonable. So make a list, make a spreadsheet. And if anyone is applying to OB-GYN, I have my spreadsheet. I've emailed it to a lot of people. Feel free to email me. I will send you my spreadsheet.
I agree with what Maddie said. I was not nearly as organized as she was with it. I just kind of applied based on region. I'm from the Midwest, but I went to school in the Southeast. So I mostly applied to the Midwest and the Southeast. And I figured that with kind of my application, I'd be able to get a decent amount of interviews based on just kind of regionality. So I looking back retrospectively, I should have been more organized like Maddie and set up a spreadsheet. But like for instance, where I'm going, University of South Dakota, they've taken one DO previously. And I think a lot of programs out there say more than not, at least in my experience, it's not that they're against taking DOs. It's just they haven't taken any, or they've only taken maybe one or two because not as many have applied, or it's just there's not as many DO students as there are MD students. So I'm sure there are programs out there that are very, solidly against taking a DO. I didn't encounter any of those on any of my interviews. All the interviews I went to that were all MD students, very nice and welcoming, and pretty much honestly said, yeah, we're not against taking a DO. We just hasn't really popped up. We haven't had any students that have applied that we, really fell in love with. So definitely can happen, within reason as far as making sure that you're competitive as far as board scores and whatnot. If there's a program you really like, you can definitely make it happen.
Can I add one more thing?
Yeah, go ahead.
I just wanted to tell a quick story that related to this from interviewing. I was at an interview and we were on this bus. They were going to tour the city, and this was at a maybe top 2 or 3 program in the country, and they had everyone go around and say what medical school they were from. And I was like one of the last ones to go, and everyone's like, I went to Harvard and Hopkins and Yale. And I was like, oh my gosh, what am I going to say? I went to this random school in Alabama, no one's heard of it. And then I kind of stopped myself and I said, instead of talking myself down like that, this is a chance to talk myself up and talk about how cool it is that I'm the only one here that's a DO. So when you get in these situations at these programs that are more MD friendly or don't have any DOs in the past, use it as a chance to talk highly of the osteopathic profession. And I think that that'll help you a lot too. Don't talk yourself down, talk yourself up, and talk your school up as well for the people who come after you.
That's true.
That's great advice. Yeah, that's what a lot of what I've experienced too. It's not necessarily that they're against DOs or like have some kind of like grudge against them anymore. It's just they honestly didn't know and they're really interested. And when you start explaining it to them, a lot of them are really perceptive to it. And I think it reflects a lot on you as a person if you talk well about your profession. Because if you come in there and you're talking, not up of your profession, then like why would they have confidence in you? So I think that's really good advice, is to be confident about the field where you came from and the school you came from. And that's all great advice. So speaking of that, for the next question, for people still on the fence about whether to take both boards that have the option to this cycle, with that in mind, in your experience, did taking both help or hinder you, or did you notice a difference?
Is it me? Oh, sorry. Just making sure my phone call is like working and everything. The internet's been kind of spotty. Sorry, guys. No, I took both boards. I was basically looking at one allopathic place that's kind of near to my home, and I knew I needed to take the USMLE in order to give myself an apples-to-apples chance to another MD candidate, especially in the competitive field. I actually, taking both, it seemed like it helped me because, I think they're different exams in their own right, but also I think you prepare for step one really hard. I feel like it automatically prepares you well for COMLEX as well. So I think it can only help you taking both exams. With that, I think with the OMM section of the COMLEX, you can kind of cram that in the last week for that exam. But I feel like for me, I want to be compared apples to apples to other candidates. And I think if I had a good step one score along with a good COMLEX score, I feel like that would give me, a better shot, or, saying like, it wasn't a fluke. He did well on the exam. He did well on both. But I think, trying to apply to an allopathic place and knowing the chances are kind of slim as a DO applicant applying to, orthopedic world that's competitive, and, there's still a little bit of a stigma there. But, I think taking USMLE couldn't hurt you. I think it can only help you.
Yeah, I totally agree. I think one of the biggest things is it just opens more doors for you. Chris, for instance, for me, without getting into too much detail, I actually changed my specialty. I was applying to like a month before applications opened. And so it allowed me to have flexibility because I'd taken both, and done decently well in both. And I think that as far as the actual studying goes for it, at least in my experience, it could have changed since then, but studying for the USMLE was the questions are more challenging. So if you study for that and do your best with UWorld and looking at first aid and whatnot, you're going to be ready for the COMLEX, because the questions, although the test is longer, there are more questions. They, in my experience, were a lot easier and more kind of first order. So if you do well on those, you're going to be set for the COMLEX, and like you were saying, you can cram the OMT in just a couple days or so, however long you need it. So anyway, yes, I think it should take them both is what I should have said. Yes, take them both.
I would just add that if you're considering doing a competitive specialty, and you can determine what you determine it to be a competitive specialty, but if you think it's going to be competitive, then I think it's an absolute must that you take both. There are multiple programs that I have talked with and talked to other people about that have said verbatim heard from program directors that they would take somebody that had taken a step and just barely passed the step over somebody that was applying without step. And I know that's different from program to program, but I would definitely say if you are applying to a competitive specialty, that you have to take both.
That's great advice, because I know a lot of us this year is going to be the only year affected by it. And that's been a lot of questions that third years have had is, should I take both with this merger? And so I think y'all brought great insight to that. Kind of shifting gears to the next question. How did you navigate couples matching and matching in a competitive field? Do you feel like couples matching as a DO made it more challenging?
Well, kind of what we did for fourth year, Anna and I, we did my audition rotations basically the same place each month. So we were kind of traveling together. So, sometimes we run into each other at a hospital, but, as well as like the program directors are kind of understand like there's, you have a significant other, you have a couples match going on. So like the program coordinators and the directors can communicate with one another. So that kind of helped us in that respect of applying the same places and rotating the same places. Cause I think I did 5 audition rotations and she came on 4 of them. But as well as if you're applying outside of, cause I'm speaking more of the DO, like kind of the former AOA programs for orthopedics, but having her, doing family medicine and applying broadly to MD places as well, we could do regional locations to where we had a hospital 20, 30 minutes from where the DO residency or formerly DO residency was. And so she could apply there as well to kind of, make our rank list a little more broad. But it seems to be friendly. I think a lot of these program directors want happy residents. They want residents there that are wanting to be there. And if they can get the significant other there as well, I think that's a huge bonus for them. So especially if one program likes one candidate too, and then communicates, hey, we really like her, let's take him. I felt like I was like the ball and chain, just because like my, life is awesome. But anyway, so I think it does help. As long as you let the program director know and coordinator understand, like, hey, I'm in a couples match and my fiance's here as well, so they're in line and they communicate. So programs talk and stuff like that on both sides of it. So I think it's definitely helpful. So I think it kind of helped out a little bit in a way.
That's good to hear, because I know just applying to residency in general is stressful, and having to do the couples match adds to that stress. And so it's good to know that y'all are able to navigate it pretty well. For the next question, how were third and fourth year rotations as an osteopathic medical student? Were your MDs attendings accepting, or did they allow you to perform OMT?
So I think this question got changed a little bit, and I apologize. I cannot comment on OMT. I didn't perform any OMT on any of my auditions. I commend anyone who did. That's very cool. But as far as just doing third and fourth year rotations at either with MD attendings or at an all MD program, I never had anyone who was unaccepting. Maybe every once in a while I'd run into someone who had just a question about it and just wanted to know more about either my school specifically or DO programs in general, but almost everyone I've ever met as a doctor knows what a DO is. So there was never anyone who was like, I've never heard of that or anything. And if they've accepted you, especially on an audition, they know what that is, or they wouldn't have accepted you, I would assume. They usually only take like one student for a labor and delivery audition or something. So they've read your stuff and they know what that is. And if anything, it was a chance to just talk about my school and the benefits of it. And so anytime I run into that problem, I always explain that, I didn't learn anything less. If anything, I took this extra class. I wouldn't have been able to take the USMLE if I didn't learn the same stuff as an MD student. So obviously we learned the same stuff. And you don't have to explain that because your board scores say that. but explain to them, yeah, I took this extra class and it was really cool and I have this extra knowledge. Even if you don't perform OMT, it's cool to just mention that you have that skill, and if they want something, you can try it. But I never found anyone who wasn't accepting, and I think that that's nice. It's good to know. Yeah.
Yeah, I think I have similar experience to Maddie. I think Maddie hit the nail on the head with, third and fourth year rotations as the student. It's just a lot of MDs, most MDs I spoke with are very accepting of it. They don't hold us in any lower status from what we bring as a student. They treat us the same. As going for performing OMT, I didn't really perform any OMT in fourth year rotations. I think I did like one little OMT on a family medicine rotation or out rural area for a headache. I think I did a suboxyl release. Outside of that, there wasn't really much OMT, but for acceptance of like DOs or DO students with MD attendees, I think it's pretty widely accepted. I don't think there was any like stigma or felt that as a student rotating. I feel like they're very open to having us there and learning, and and you're just putting your best foot forward to learn as much as you could that month, and that's all they kind of really hope for. And so outside of that, I don't think there was really any stigma or anything like that against us as an osteopathic student rotating.
If there's one thing I can add, I think one thing that my second away rotation I did was at a bigger MD institution, which is much more on the academic side. And initially, I was like super intimidated, and when people asked me about where I went to school, I almost kind of like said Alabama College of Osteopathic Medicine, and kind of was like a little intimidated to say it. And after like a week or so, I was like, what am I doing? I got to kind of own up to this, kind of like Maddie was saying before. And honestly, after a while, it became a talking point because people remembered you. They see so many students come through there, and then you're just another person, for surgery, you're just another person with a mask and a full gown on. So they don't really even know what you look like. So you say, oh yeah, I'm a DO. That's something that's unique. And I think, at least in my opinion, most of the actual clinical doctors, they don't really care if you're an MD or a DO. They just want good residents who are going to work hard and who are going to do right by their patients. So if anything, in a way, it can be a good talking point and a good way for some of the attendings to actually remember you, saying, oh yeah, that's the DO guy, DO girl, whatever it may be.
Can I add something?
Of course, yeah. Go for it.
So this isn't necessarily about being a DO, but I think it is something that most DO schools probably have. So ACOM being in Alabama, and a lot of our third year rotations are in more rural areas. I was even at one of the bigger sites in Birmingham, and we still worked at a smaller rural hospital for third year rotations. And something that I think was a huge, huge benefit, and probably I would say presents with most DO schools, you're not going to be at a huge university hospital for your third year rotations, which sounds bad, but in reality, I think it was immensely helpful because especially if you're applying to something surgical, and I don't know if Sam, if you had the same experience at your site, but we got so much hands-on experience. I mean, it was so high, like very, very hands-on. And my first day as a auditioning fourth year at a big, huge MD state school, the third and fourth year students did nothing, and they didn't know how to do anything in the OR. They barely knew how to suture, and I couldn't believe it. And at first I was like, this is so crazy. But I realized like, wow, this is a cool moment for me to shine and say like, yeah, I went to this tiny school in rural Alabama, but look what I got to do. And look what I know because I went to this small school in rural Alabama. And you'll find that there'll be instances where you get to show that off. And I remember explaining to some of the residents, like, yeah, I do know how to, do a C-section. Like I certainly am ready. And, at first there was definitely no room for students to do stuff like that. And one day there was a stat C-section and no one else around but me and the attending. And she said, you said you could do this, can you? And I said, yes. And I did it. And she wrote me this great letter of rec. And I never would have been able to do that or know how to do that had I gone to this huge academic institution for my third year rotations, where I might have been the fourth person standing at the end of the operating table. So if you go to a small or rural school, especially DO school, use that to your advantage. I think that that's really, really helpful.
I think that's great advice. Sorry, were you going to say something?
No, I was gonna kind of touch on that a little bit. You know, as a DO student, like during third year, you know, my rotation side was at Jack Houston, and you know, they were very like open to letting students get their hands dirty, especially in surgery, to kind of learn how to suture and learning how to like retract and do things like that that kind of make you stand out in these like audition rotations and things like that. Since rotating an allopathic place, for orthopedic standpoint, they were, you know, kind of surprised like how much like the DO kind of knew. I think when rotating there, it was, I think, doing audition rotations as a DO versus doing audition rotations as MD, I think the expectations are a little bit different. And as a DO, they expect us to know a lot more and kind of like study up on ortho. And then when I went to an MD place, an allopathy place, and kind of like they're going through fracture conference and they're showing up pictures and things like that, or like surgical approaches. And when you're asking questions that are kind of like in depth of like knowing kind of how it works, they're kind of surprised like how much you know. And I think, you know, if you go to like a community hospital like that, you kind of get your hands dirty, you kind of learn more, you know how to suture well. So it's just, there's a lot kind of more free reign to kind of to learn a lot more and get more hands-on and feel confident to be able to do the C-section, or feel confident to, you know, make an opening incision and closing up, or being confident like, hey, you can close the side, I'll close the other side, and know that you'll do a good job. So that's something, you know, as a student, you do a third year and you have the opportunity to get your hands dirty and do a lot more kind of practical kind of things. I think that definitely kind of really helps you develop as a student into a physician.
That's all great advice. I mean, especially the name of the game is trying to get an edge wherever you can. So that's really great to know those things and apply those. We're going to go ahead and move on to some of the questions that were asked during the chat. And we're going to try and reserve enough time, about 5 minutes till 4, to let everyone do their closing statements. So with that being said, from the chat we have, and anyone feel free to answer, would love to know how to ask to shadow now during COVID. I don't know if anyone has any advice on that or would like to say anything. Yeah, I think in general for that question, it kind of is a constantly changing thing with everything going on. As new studies come out and new things come out, that's going to be something that's we're constantly having to adapt to. And me as a third year, I'm right there in the same boat. We'll just have to go with the flow until things get more concrete. The next question, can you share what a typical day was like during each year of medical school? Which year do you think was the best year and which was the hardest?
I can share. I would say the hardest year was, for me, by far, fourth year. I think everyone says fourth year is so much fun, and it was, but it's very stressful going through the match process. And that was really tough on me because I felt like first, second, third year, you know exactly what to do. You know how to get a good grade on the test. You figured out how to study. You know how to do well in your rotations. But you don't know what the match is going to bring. And so all of a sudden it's all this unknown, and it's a lot. And going on auditions and going on interviews, you know, you've never done that before and it's scary, but you just have to kind of hit the ground running. So I thought that was the hardest year, just the unknown of what the match would bring. And obviously with the merger as well, I'm sure people who are applying to AOA or are not sure, or couples matching, things like that, that would be really scary as well. And, you know, during those times, reach out to your mentors, reach out to people that you trust and can talk to. And you're not alone in that feeling at all. Everyone I went with on interviews was equally stressed. So it's nice actually to be around other people at interviews and auditions who are under that same stress and can feel it with you. And a typical day in med school is different with each year. So first and second year, you, at least at ACOM, we sat in a class for maybe 4 hours a day, I think. I'm not quite sure on that one. Kirk and Sam might know more. So we sat in class for a couple hours a day for lectures, and then there would be maybe a lab or something for a few hours, and then you could study. So I like to study early in the morning. Some people like to study late at night. I always made lots of time for myself, and I just planned it ahead. So yeah, I think in general, first and second year and forever on, if you want to, you know, go to a football game or whatever, you can still do those things. Like med school isn't the end all be all. You don't have a life. You just have to plan ahead and say, maybe I have to study 10 minutes more every day this week, and then I can do those things. So yeah, I don't know, 3rd and 4th year days, maybe someone else can talk about those. It's all different.
Yeah, I think in short, it seems like almost every year that you're currently in is the hardest year. I think it changes every year depending on what you're dealing with. But obviously, tons of people make it through it. And so, I mean, you just kind of keep reminding yourself of that. For the next question, what can be improved upon now that the process is merged? Are there issues specific to DOs or both MDs and DOs? If anyone wants to try to answer that. That's okay. Also, if we don't have a necessary answer, I think in general, with everything new going on, that we kind of addressed some of this during the talk prior. I don't know if anyone wants to expand on the answers that they gave previously, but I think it seemed like for the most part, things went as they expected and they liked the process. I don't know if y'all have anything y'all didn't like, wanted to change.
Yeah, I don't know about like the whole coronavirus COVID situation. I'm not really going to speak to that because obviously nobody knows what's going to happen. But as far as like being a DO or just auditions in general, like it really comes down to like you working hard and putting your best foot forward. And like not to be all cynical, but like the system, quote unquote, the system's not going to like help you or whatever. You got to go out there, and if you really want to go to like one of the big MD academic programs, by all means, go and audition there. You can even audition there twice if you want to really, make a point that you want to be there. So as far as like things that need to be improved for DOs versus MDs, I don't really know if there's a great answer for that because there's no.
I agree with Sam.
Just study your butt off for boards and, do well in your classes and then go on your auditions and, the other stuff like the institutional, the big rules and stuff. You can't change that. You can't like let that stuff get you. You just gotta like put your best foot forward and grind every day.
I agree with Sam. I mean, go for the REACH programs. You really don't know who's going to give you a chance. It doesn't hurt to go and try and give it your best. I think as long as you're a decent applicant for whatever specialty you're applying to, you should always try and reach those dream goals. I think that they're attainable. If you go and you work hard, it's always possible. Like, don't undermine yourself or your application, and at least give them a try so that when it's all over, you can say that you gave it your best shot and you're happy with what you did. And that's how you ended up where you ended up.
All great advice. I think we have time for one more question. Did any of you have to go on an interview during an audition rotation? If so, how did you handle that?
I'll answer that, or I can give a answer. So I did family medicine, and pretty much every place that I auditioned, we did an interview at the end of the audition rotation, just because they knew that I was traveling and, they wanted to save me the trip, I guess, back up there. And so it was a little bit different than the rest of my like more traditional interviews because they know you all month long. So they don't really ask like, tell me about a time when you displayed you were a hard worker, because they already know if you're a hard worker or not. So it's much more, I would say like much more personal questions. Like they ask you like, what are you looking for in a program, or things like that. But I thought that those interviews were always really good because you knew more about the program than you did on your more traditional interviews where you only got to see the program for a day or two. And with that kind of being said, when you do your audition rotations, I don't think it's a good idea to be nervous throughout the entire thing, but I do think you should go into it every single day thinking like, people are watching me. This is an interview. Just, you want to be yourself, but you want to like put your best foot forward every single day, because you can't just, slack off all month long and then at the end of the month try to say, yeah, I'm a hard worker, and because actions definitely speak louder than words.
I also had to go on lots of interviews during auditions, and I think that the best thing you can do, especially if you're auditioning at a program that you really love, but obviously you still have to interview at other places, is just plan it so that maybe if you can, have it grouped into a few days at a time. So maybe you're going to do, I had one where I did like a Monday, Tuesday, Wednesday. I did 3 interviews in a row so that I could tell them, hey, I'm leaving for just this chunk of time. And it was closer together instead of coming and going and coming and going. But obviously you have to plan them the best you can. And just tell them the very first day of your audition, say, hey, I want you to know upfront that I have these interviews. These are the days I'm going to be gone. And I'm happy to work an extra night shift, or I'm happy to come in on the weekends, whatever I can do to be here and make up for that time. Just be upfront with them, and people understand. Everywhere I went was very understanding. Even if it's your number one program, they know you still have to go other places.
That's all really good advice, because yeah, that is a big concern, being on an audition rotation. But it sounds like, I mean, that's what we were hoping. Most places understand that we have to interview, and so there's not really necessarily a choice. So with that being said, we're going to wrap our session up. I want to remind y'all that tonight, don't forget to tune in at 6 p.m. to hear more on the use of OMM and practicality of it from an OMM fellow and current DO internal medicine resident. It'll be a Q&A format again, so come with questions. With that being said, I want to open the floor to let everyone go ahead and do a closing statement and any last minute things they want to address.
Yeah, I think you guys are doing great just by being interested so early, and just go out there and put your best foot forward, and you guys will all do great.
Yeah, I agree. The same thing. Go out there with the auditions and just, give it your all. I mean, it's just, you have a month there just to kick butt and just be on every day and treat everybody really nicely. It goes a long way. And just be open to learn, and it's okay to get things wrong, but just keep on trucking and keep trying to learn each and every day. Third and fourth year kind of fly after you get the auditions and you wait on this whole match process, but just keep working hard. If you're studying for boards, just keep trucking. It's just a long process, but it's totally worth it. Your boards just get your foot in the door, and that from that point on, it's just like just being a good person, being someone who can work well with others, and being a team player, as like we've all stated earlier. So just wish all the best of luck, and feel free to ask questions.
I would say my best closing advice is that just take it one day at a time. Every day is different, and there's going to be a lot to do every single day. But I think the best thing to prevent yourself from becoming too overwhelmed is just taking it literally one day at a time, one step at a time. Don't try and do all of it in one day or all of it in 1 week. And you'll get through it. Everyone does. And reach out to people. Never be afraid to reach out to the alumni in your school or people older than you. People want to help, and they will help you. So always reach out to people, and stay close with your friends and family. Like, don't let those relationships slide. Make sure that you still have those loved ones in your life during this.
I would say what Maddie said, you've got to definitely keep your ground. Remember who you are. Remember why you chose medicine. There are going to be stressful days, but it's definitely worth it in the end. You will definitely get through it, and you will be a physician, and a good one. The first thing is to make sure you do well on boards. I know people will say that all the time, but it is very important. It's normally what gets you your first foot in the door, even for auditions and for interviews. So number one, do that. Number two, if you have a place that you want to go to really bad and you have reasons for it, and they did not offer you an interview or an audition just from using the services like the ERAS and stuff like that, reach out to them. Call the program coordinators. I even called a program director's personal like number, like his office number, and I ended up getting an interview out of that. So if you really want a place and you're really dedicated to that specialty, and to that area, if you're from an area and you haven't gotten an interview from there, make sure you reach out to them, let them know that you're really interested in the field, that you're really interested in coming back and serving that area.
I totally agree with everything that's been said. I guess I'd just add, just remember the big picture. So whether you're pre-med right now or if you're in med school right now, like remember why you're doing what you're doing. For instance, for me, like yes, it's important to do well on board because when you're studying for step one, it's like feels like the biggest thing in the world, and it is huge. But also remember, your life doesn't revolve around medicine. You have a family and other commitments that are important as well. So your life does not revolve around med school. A lot of your time revolves around med school, but there are things that are also important. So if you're trying to get in med school and you don't get in, or if you're in med school and you're not doing well, or whatever it may be, realize it's not the end of the world, and there are so many bigger things out there. So just keep trucking along, like everyone else said, but keep in mind that big picture.
Well, thank you all again for taking time to be here and discuss those questions with us. Y'all were a great inspiration, and it was really inspiring to hear y'all's answers. And thank you, audience, for tuning in to attend this live event. And again, 6 p.m. tonight, we'll be hosting another session. Thank y'all.